Dear colleagues, today we will be talking about assessment blueprinting, but before we proceed, I would request to subscribe us so that we shall make a team that can easily disseminate the knowledge across the globe. These are the objectives, and we will be focusing on blueprinting. You see, and what is blueprinting? It's primarily relates to the primary construct and design of a particular item. So it is a course, open course. Then it means that what it could be primary structure, what could be the contents, what could be the objective, what could be the learning outcomes, what could be the mode of information transfer, and so on, just like table of specification, you know. And then you see assessment blueprint mean that what will be your assessment tool and how you will be your assessment tool and what you are going to assess, what will be the difficulty level and how much will be the number of questions. All these things are being answered in assessment blueprint. So let's proceed. You see, selection of the right tool is very important, and for that you have to consider that what you are assessing, how you are assessing, and what is important, that how will your task elicit as evidence, you see, that what you have taught, what the student have learned, that has been really learned, meaning that you have really assessed the curriculum or what you have delivered curriculum. So this is very important. Sometimes the most primarily problem is that you teach something and assess something. We will come to that point later on, but you see, assessment is a continuous process or cycle. So first you teach, then you measure that whether the learning has occurred, and they are the reflection of the teacher and the students, and then based on these reflection you revise or revise, whatever the case is, where you continue with their tool of assessment. And so this is a continuous process, or this continuum goes. Now it is pertinent to mention that, for example, you have course contents or learning objectives, and then there is a learning experiences. You see, some of the learning strategies are there, learning strategies that are adopted, like problem-based learning, lecturing, you see, whatever the case is, and then TBL, team-based learning, small group discussion, and all these interventions once occur, so then you are going to assess all these things. And remember, look at this diagram. This blue is the curriculum that you teach, but the teaching method, sorry, and the curriculum is this particular color. So curriculum is here, you are teaching here, and assessment is somewhere else. So if all things are scattered here, and remember, learning happens in a particular small tiny environment, and all these things superimpose in a very small portion. So what is important to understand, we have to align this, and for alignment of this one, you see, you have to synchronize all your activities. So curriculum alignment should be there with the teaching methods, with the assessment, and rest assured that the learning has occurred. So important to understand is, you can see on the left side that without a blueprint, you see, all things are scattered. If it is the primary centers of this activity, this activity, this activity, so all these primary center that shall superimpose, like it is here the primary center, so they are all superimposed, and this is because of the blueprint, and they are all aligned, and what you have taught, what the students have learned is properly assessed in the right case with the blueprint. So what are our aims? Our aims are, you see, you can read this. The student says after the paper that this question was too vague, too lengthy. All questions are view system based only. Long question were the bouncers, you see. So these are the student comments. So in order to answer and to remove or to optimize the assessment tool, so that there shall be no abuse of the assessment tool. Rather, the best terminology will be then we go for the blueprinting. Remember your curriculum. In the curriculum there are objectives, and each objective, then these are objective, program objective, course objectives, problem-based learning objectives. They constitute, goes towards make outcomes, you see. And one outcome are very broad, so one outcome may have few objectives, you see, 1 2 3, like the same. It is just like antibody clumping mechanism, you see. And different outcomes, these different outcomes, you see, when they are contributing towards different standards, you see, or competencies. And you know, competencies are the ability of a graduate to perform certain tasks independently and efficiently. Thus, our primary focus is on the primary standards, you see, on the standards. For example, CAN-MET standard, like a physician is a medical expert, he is a communicator, researcher, and so on. So, what is important to understand that if you are going to make a blueprint primarily focusing on an objective or an outcome or a content, you see, so this shall align with the primary standard as well. Keep in mind this point. Keep in mind this point of standard, because this will help us in devising an assessment tool. Let me proceed. So you have to focus on the learning domains as well. Now, you know, as I referred in the previous slide, that there can be many objectives, 1 2 3 objectives, and that goes to the outcome. And these outcomes, you see, then there can be different outcomes, and that attributes to the cognitive, affective, or psychomotor domains, and then they contribute to a competency. So as we said in the previous slide, remember, assessment blueprint and the competencies, there should be an alignment as well, as I referred to in the previous slides. So this is just to simplify all these things, that you have to make all these thing alignments. Let we go ahead for an MBBS curriculum, or what you can say a Form D curriculum. And in the first year, you see, this is phase 1. You see, these are the preclinical sciences portion, and this is the clinical sciences portion. And for an MBBS, you see, when he graduates, then he goes and become a resident or house officer. So this is a longitudinal, what you can say, the curriculum duration, and this is divided into preclinical phase and the clinical phase. This is the preclinical phase, and this is the clinical phase. Now, what to do? This is the entry level, and this is the exit level of this phase, and the exit level of this phase constitute the entry level of phase 2. Remember, in other words, we are going to prepare candidate in phase 1 for the phase 2, which is the clinical phase, and we are training him at phase 2 in the clinical phase to become a good house officer. Now this is very important to understand. So in phase 1, we primarily focus on what you can say, the preclinical phase. Remember, it is pertinent to mention that once you are going to make a blueprint, you must keep in mind that you are preparing blueprint for which level of the students. As I refer to, if it is for an MBBS program, so what you will do, you will focus on the phase 1, and then on the phase 2, and then the resident level. And likely in the phase 2, you see, you will be focusing on that you are preparing the student or the graduate for this phase. So you have to determine the impact of items that you are going to teach, or the skills that you are going to render, you are going to offer them, and you are making your graduate a competent graduate. So for that, once you assign certain impact to that course content, you will also have must assign certain frequency, that how frequently do you come across with that particular course content. Once he will be a graduated doctor, so how he is going to come across with all these cases, and how he is going to tackle all these things. Because once you assess that particular graduate, that will help him to prepare him for a particular one of the standards as mentioned, like in CAN-MET or Pakistan Medical and Dental Council, or if he is a pharmacy graduate, placed by the Pakistan Pharmacy Council, or as the case may be. So what are the steps? Define purpose and scope of the blueprint. This is very important. In step first, you have to define the purpose and scope of the blueprint, and for which semester you are going to prepare, what is the level of that first year, second year of the program, undergraduate program, what is the assessment tool, how many questions should be there. These are very important. And then you see, you shall primarily refer to the standards. Sometime the teacher makes a mistake or the curriculum system make a mistake that they miss the standard. For example, if I refer to the CANMET standard, so for a medical doctor, he shall be one of the standard is medical expert. Second is the communicator. Third is the researcher. So what I tell you that for which you are going to prepare a blueprint, you shall refer that to which particular standard you are going to contribute, and your assessment tool is going to assess the candidate for declare him that he has gained the targeted key core competencies. So step 2 in this case will be that, and step 3 you have to tabulate the curricular contents in an Excel sheet, and then identify the impact, and then give to it a certain frequency. Dear colleague, I told you in the beginning, and this is one of the if I share with you, this is one of the the course, that cardiovascular course that we have prepared. And if you can see here, what is important to understand is that we listed the contents. We listed here the contents. Here we listed the contents. These are in Excel sheet. Then this is the mode of information transfer. For example, this topic is introduction to the cardiovascular block. It is taught by the lecturing method. Some are to be taught by the PBL. You see, myocardial pericarditis. That is maybe a case may be presented through the problem-based learning. Here the case may be. Then its impact is given in a numerical values, and then the frequency, that how frequently they come across. And when you multiply this impact with a frequency, so it gives you a particular mathematical number. And if this number is high, you see, then certain values, then we go for the what you can say. Then we go for the let me for you. So I'm going to share with you this. Yes, this is an Excel file that cardiovascular course contents. If I make it for you much more a bigger one, so you see these are the contents. Then the mode of information transfer. This is the impact, and this is the frequency. You see, frequency cannot be 0 because this was an introductory lecture. So we place this in a primary timetable in the opening of the course, just for the students' guidance. Then you will make it, determine its weighting, and once you determine its weighting, so what you do that you multiply the impact with the frequency, and you get a weightage. You see, so the total values, and then this values, you see, you have to give a particular weightage, and weightage is how weightage is given, that the total sum of this product value, you see, is 191 here, because it's around about 66 or some items are here. So now its value is sum of the values of impact multiplied by frequency. You can see that is more than a reference values, you see, and these reference values will be discussed in the next slides. So if all these things are highly important topic, and because they have highly impact and frequency, you can see here, this is the impact is very high for this topic, that is the drug therapy in rheumatic heart disease, because this may damage your patient forever, that may become with heart valve disease, and then it can create problem for him, and how frequently the physician come across with this. So 3 multiplied by 2, it gives you 6. And here the impact of this particular topic like cardiac cycle is very important, because always in the practice of cardiology or heart related problem, the doctor requests a cardiac cycle. He must know the cardiac cycle, which include electrocardiogram, action potential, heart dimension, all these size and sounds you see. And this is the primary topic in this cardiovascular block. So it is given the most impact 3 and the highest frequency, how frequently they come across as a physician. So it gives you a higher value 9. Now all these values are then made summated. For example, here is 191, and this 191 is the sum of the product of this impact multiplied by frequency. So what you will do in here, in case of giving weightages, the next step is to give it weightage. So once you are going to give it weightage, so what you will do, this values, you see, this particular value in this cells, you see the H1. So this product value is divided by the whole 191 sum value of this total product value, and so then by this way you will get the proportionate value, and this proportionate value is then will tell you when you make it sum. So it's roundabout, it is numerically it goes to 1. So this is all these proportionate values among this, you see, will tell you that how important which particular topic is for to get the number of items on the right column here. And to get the number of items, how you will get it? You will get it that you multiply here this with to get the weightage with the frequency and impact. But here in case of the number of items, what you will do, we usually consider that at an average for 0.3 difficulty index, this relates to the item analysis, you see, which is not the domain of this lecture. So on average for a 0.3 discriminating index, usually 50 to 60 multiple choice questions are required, and for discriminative values less than 0.2, these are reference values I am referring to, then 100 multiple type questions are required, MCQs are required. So as a rule of thumb, 50 to 60 MCQs are required for an MCQ type based exam, especially for a targeted discriminating index 0.3. So when you multiplied this weightage with the 60 number of the multiple choice question that we have, so what you will get? You will get the relative items values and number, and these number will then determine that this will be the multiple choice question, you see, and the total multiple choice question here will be 60. So let me carry you back to the PowerPoint presentation. Tell you one thing more. Similarly, we have designed this for a renal course as well, and this for renal course that we have taken from one of the research paper from the University of Calgary that they are going to adopt. They have adopted. These are the contents of renal course, and then this is the impact, and this is the frequency. This is product of these two, and then weightage is given because the total sum is 80, and then you proportionate values in this 80 how much topic is contributing to this. Consequently, then you what you can say for an 60 MCQ, you see targeted, you just propagate the proportionate value, and this proportionate value is that you multiply with targeted MCQ and you get the number of items. So it means that you will this higher value is for the hyperkalemia. The higher the value, the more will be the importance will be that it should have much more number of questions in the assessment tool, and this is the way, one of the way to set the assessment blueprint. So let me go to the PowerPoint presentation. Now the next step is that you determine the, what you can say, you tabulated the curriculum, you identify the impact and frequency. Now you get the weightage, you see, Dear colleagues, important thing is that for impact, you see, you have to describe certain narratives. For example, less important for page, next page, you see they are given a score of 1. And in certain cases, you see, uh, you shall make the things very evident for the very clear narrative shall be given. For example, while calculating impact, a topic may be less important, a topic may be important for phase 2, and a topic may be very important. Very important is given 3 number, or mid between that is given 2, and the less one is given 1. And similarly, that is for the frequency. So you will do like that. Now decide on the number of the item for each content of area. As I refer to when I was on the Excel sheet, that as a rule of thumb, uh, what the Hopkins says that 0.3 discriminating index, you need at least 50 to 60 MCQ. And in the renal course, you see they targeted the 60 MCQs, and then they get the item number as I refer to in the Excel sheet. But for a poor MCQ with a mean discriminating index less 0.2, then you require 100 MCQs. So this is a technical point to remember. Usually while planning and devising a curriculum, we usually target a discriminating index of 0.3 so that you will be at ease to deliver this curriculum when you assess this curriculum. This is the part of item analysis which is not the domain of this lecture, but this is a technical point to remember, that when you are going to plan an MCQ or an assessment tool, you see, so what you will do, you will keep in mind the discriminating index, and from it is the discriminating index that will determine the number of MCQs as well. So this is based on already statistically proved item analysis related research paper studies. Now let me proceed to the next thing. Now you will categorize the contents. Some contents may be very important. You see, when you get this 6 to 9 values in this in the weightage that we calculated in the Excel sheet, and when the value is 3 to 4, and then the value is 1 to 2. So the value is 1 to 2, it is considered as nice to know, and should know mean when if it is 3 to 4, and must know it means they are very primary important topics of the content. Therefore, dear colleagues, it is very important to determine the level of this or to categorize the contents, so that you shall contribute very easily to the blueprint of the assessment tool. The higher the value, mean like this 9, 6 to 9, the more important is the content and shall be given much more weightage. Alternative method is that you multiply the impact with the frequency, and then with the total curricular content, you see proportionate values like 191 was in case of cardiovascular course, and then you multiply that with the with the with the 0.3 discriminating index, you see. So you multiply that with the, and you get the item number. This is an alternative method. Now once you decide on the percentage of the question, now you have to decide on the percentage of the question. So 6 to 9 is as must know, and let's say they say 60% question shall come from this and 30% shall come from this. This is based on the research and based on the importance, and all these things will contribute to the 100% of this category. This is a technical point to remember. And remember, this is from where we came to know about this must know, and the 6 to 9 will from where it came. It came from the Excel sheet. Once you multiply that impact with the frequency and then get the weightage, you see, so you will get the number of the items here, and this is the number of items that we got, and here you see, here you get now decide on the percentage of the question. This is once you categorize the detail of your curriculum content, you see. For example, once this portion of the table shows you the categorization as I discussed in the previous slides. This is the fraction that proportionate that 60% shall go for this, 0.3% and 0.1 mean, and the whole value will be equal to 1, if it expressed in percent, so it will be 100%, 10%, 30%, 60%. So if I apply this to our course of the cardiovascular, which is uh, explicit as that it has 50 MCQs in the mid block and 60 MCQs in the end block. So if you apply this on this formula, that where the item value is from 6 to 9, there will be 30 MCQs, you see, items, and the value with the who should know that value shall be 15 amongst these 50 MCQs, and among these 50 MCQs, nice to know values number of item will be 5, and this will help you in determining the blueprint of the MCQs. And same is the case for 60 MCQs and for MEQ, SEQ, OSPI. But remember, this will be in our system color system. This is the end block, related to the end block exam. So in this presentation, we will be focusing on the MCQs, not on OSPI, SEQ, MEQs. So in the mid block or the end block exam, you see, we have primarily targeted the MCQ blueprint in this presentation. So once you did, this is some data available in our college related to the cardiovascular block, that how much MCQ will be from this, how much will be from this. And remember, now since the curriculum is taught through a blend method, integrated method, so it has different disciplines like pharmacology, anatomy, physiology, microbiology, community medicine. So for pharmacology, just as a rule of thumb, now the contents of the curriculum or the objective of the curriculum or the outcomes of the curriculum, what you have to do, you have to list in a column. And the must know column that shall be segregated like this. These topics shall be mentioned here, and similarly you put the topics, list the topic here that where the candidate should know, and nice to know category shall be also. So they are categorized primarily in 1, 2, and 3 way. Remember, now the number of MCQs are allocated here. You see, if 60% is for this, 60% is for this as per the formula. So out of 9, 5 MCQ will be there. And for out of 9, 5 MCQ will be there, and the 30% mean out of 9, 3 MCQ will be there, and 10% mean out of 9, 1 MCQ will be there. Now you have to allot this, keeping in view the cognitive domain, the Bloom's taxonomy: recall, mean remembering, understanding, and analysis. So it's up to you which particular number of MCQ you are going to test. But the net sum of this shall be meaning that shall be the same, so that there shall be not a problem at the end, once you will get a final total curriculum, total blueprint of all related courses. You see, curriculum blueprint. So what is important to understand? Important to understand is that, in summary, the MCQ, what we do in the MCQ blueprint, first step is to list the topic to be tested. The second step is decide the number of the question per topic. The third one is decide the level of the Bloom taxonomy, like recall, understanding, application. The fourth one is decide on the number of the question per level. And the final one is that decide the difficulty level for each question. For example, a question may be medium, moderate difficult, medium difficult, or very difficult, and this may be very easy as well. So easy, moderate, and difficult, you see. And once you all do this, and this will make your multiple choice question assessment tool blueprint. So you see, in summary, if your curriculum is without a course is without blueprint, you are teaching something, you are assessing something, and they are not aligned. Whereas with blueprint, all the things are aligned, and this an aligned blueprint will then help you in achieving the targeted standards for a particular graduate program, whether that is medicine, dentistry, pharmacy, or nursing, or as the case may be. So I think you understand now the concept of designing assessment blueprint and curriculum, you see blueprint or related to blueprinting. These are the further readings and that can help you. Thank you very much.